consistent themes, right? If you've experienced trauma as a child that leaves you in a dark position or a vulnerable position or unsafe or any of those things, those are the exact same themes that you're facing when you're in combat as well. And so these themes are not just contingent upon a certain period of time. It's kind of like a thread that runs all the way through, right? And it just has certain points where it's hotter than others. And so you do need to understand that, because then we can understand reactions much better.
Absolutely. And gauging that reaction is really trying to understand who that patient is. Is that correct?
Absolutely. And all of the factors at play.
Absolutely. And that, it just leads to better care. And by getting better care, better levels of service, you are opening up and blossoming, for lack of better words, right?
Mm-hmm.
You've
Oh,
starting to
absolutely.
come out of that shell.
Absolutely. I actually have a guy right now who, gosh, he served, I think, 12 years. He was infantry, multiple tours. And when he came to me, he was coming for combat stress, is what he thought, truly thought, and claimed. And then we actually sent him inpatient for a period of time. And he came back from that a completely different person and said, "Did you know I had childhood trauma?" And I said, "I did know that. Did you know that?" And he said, "No, I didn't, but I do
Wow.
now." Like, it was all unearthed. And he said, "Now I can understand everything so much better. And I had no idea that had such an impact on me." And I said, "Yeah, well, now we can actually get to work."
That's huge. That's so huge. Dr. Kano, if you don't mind, just kind of guide us through that process for the inpatient treatment, because I've had a lot of my buddies who've actually been through that inpatient treatment, and I've had mixed reviews on it. Some of them say it's crap, blah blah blah, it doesn't work, and then some of them had said it's phenomenal, changed my life forever. So, is
Yeah.
it the place, or is it the person, or is it a combination of both?
It is a combination of both. I will say that we refer to a couple of places specifically because our guys come back and say, "Listen, I will vouch for this place because it was so helpful to me." So it's not unlike anything else that is veteran related. It's word of mouth. So if they come back and say it's good to go, then I agree it's good to go. So we refer to a couple places primarily because the outcomes have been very good. But a person has to be able to be receptive to the information at that time while they are there, because there are people who go inpatient and will come back and have gotten nothing out of that, and someone else beside them will have gotten everything out of that. So it is
Wow.
definitely a combination of things.
Absolutely. And your typical inpatient, are they going for 2 weeks, 4 weeks, 6 weeks? What's that time frame, or does it just vary?
A lot of our guys are going for anywhere between 4 and 8 weeks.
Oh, okay.
And that's
Wow.
dependent on them often, how long they want to stay there. There's a minimum time frame for stability. And then sometimes the clinicians there will say, "I think that you're ready to go home." And they can say, "I think I need a week or two more. Like, I'm not quite ready to go home yet." And they can stay a little bit longer. And then obviously there are some cases that they need to stay longer.
Yeah, absolutely. Well, so when we think about that, the level of care is just different across the country, right? So
It
is
is.
there any way for us to help standardize that, or make sure that we're going to the right places in our community?
That's a tough question because you either have VA sponsored inpatient facilities. And the one thing about the VA that's difficult is uh, everywhere you go in this country, you will get a different experience. So it's supposed to be a system that is standardized. Yet, if you talk to veterans, they will tell you none of them are the same. And so you never know what you're going to get when you go. So
Right.
unfortunately, that is true of their inpatient facilities as well. And then when you're talking about private facilities, inherent in the private pay process, or however they work that, is standardization is more of a choice there, right? It's not mandated by any legal body or anything like that for the most part. So,
Oh,
I mean, there is certain regulations for insurance, of course, but if you, just like me, having a private practice, things are only standardized because I make them standardized, not because
right.
somebody's over me telling me I have to,
Hmm,
like
okay.
the VA system. So it is hard to say that we could have a completely standardized process across the country.
Well, when we think about that, is it really that hard if it was run by the Veterans Administration and not farmed out? Could it possibly happen?
In theory, that's a tough question because, again, in theory, the VA is a standardized process, yet people do not have the same experience of every facility they go to, even state to state.
Well, and I've spoken on that before, where my experience with the Veterans Administration in Vermont, which actually was in White River Junction, New Hampshire, was phenomenal. Then I come here to this Atlanta facility, and it's horrible. It's supposed to be level of care same, right? Uniform? No,
Well, and see,
not even
this
close.
exactly, and this is the frustration is, in theory, it is supposed to be standard, and it's one big company, right? The VA administration with their practices or their clinics all over, but yet this is what we hear all the time is one is different, one is better, one is not. And so if that's happening now, just imagine them trying to get complete standardization across the board with an inpatient facility.
Right. And I think what you said earlier is really key. We've got to have word of mouth. We've got to have good communication in our own veteran network to vet out the good ones and weed out the bad ones.
Mm-hmm. Well, and you have to consider different people need different things. So there could be one location that serves one person really well, but it's not what the next person needs because their needs are different.
Yeah, that's so true. Dr. Cano, this is a Veterans for Cannabis podcast, so I can't go forward without asking you about cannabis. Is cannabis something that you utilize in your practice, or is it something that your patients come to you from our veteran standpoint and ask about? And do you help guide them in that process at all?
So what I can tell you is in Colorado, medical and recreational are legal.
Mm-hmm.
Therefore, I will tell you probably 99% of my veteran population is using cannabis, whether that is to get themselves off of pain medication or lesser pain medication. Some of them do it instead of using their anxiety medications and things like that. So it is highly utilized, at least in this state. That's kind of a tough road to hoe because we have to be careful with the VA, of course,
right.
And benefits and things like that versus what people are actually doing and what's helping them. And so I personally can't help guide them in any particular direction given my role, but I am definitely aware of how many people are using it and that they're having really good outcomes.
And that's the frustrating part from our standpoint. We
Mm-hmm.
know anecdotally how well this is working in our veteran community, but the Veterans Administration won't get behind it. And then you've got Senator Isaacson who wants to now study mass shootings and see how we can improve that. Yet he won't get behind something we unequivocally know is saving lives.
Right.
And it's like, what do we do? What can we do more to help you change your mindset? And unfortunately, I don't think it's going to happen until we get these old bodies voted out of office.
Well, you have to keep in mind when you're talking about old bodies, a lot of those people were young in the era of reefer madness, if you will, and a lot of propaganda as well. And so the ideas that they were raised with and that they were indoctrinated into are pretty hard set, right? I mean, if you spent 40 of your years thinking one way, it would be hard to just shift gears because legislation has changed. And so we're changing mindsets. And I think the people who change more than anything are people who have, I don't want to say become desperate per se, but who may never have touched it in the past and are dealing with their own pain conditions and think, well, nothing else is working, let me try this. And then they change their mindset because something like that is actually working for them. And so they've had to have their own lived experiences in order to change that.
Well, I can't tell you how many times that exact story has happened to me very specifically. With starting Veterans for Cannabis, the real focus is that when we get into this, we're advocating at the state level, and then these elected representatives and senators, they don't want to mess with it. And then guess what? When their wife or grandmother or husband gets cancer, who's the very first person they call?
Mm-hmm.
Every single time.
It's
It never
absolutely
fails.
true. And so that's how these minds are getting changed, but it's a slow process for sure.
Right, absolutely. Well, Dr. Kano, I can't say thank you enough for taking the time with us today. So I want to, close out by you just telling us a little about your focus, your area of practice, if you will, and what you think we can improve on moving forward, or where you think psychological medicine, if you will go.
Well, honestly, I do think psychological medicine will be more supportive of cannabis as time goes on. Most recently, ketamine has been utilized more often for treatment-resistant depression and chronic conditions. So we are seeing a shift in the field, definitely, and more research to back it. In our practice, we try to integrate a lot of things like neurofeedback, acupuncture, yoga therapies, PEMF, things like that to help rehabilitate the entire person we're integrating, I guess is the point. So we're pushing integrative wellness, not just the standard medication and therapy, but all forms of healing that can help a person rehabilitate.
Wow, you're amazing. I can't say thank you enough. If our listeners want to, check you out or look into your practice, you want to share a little information about how they can look you up?
Our website is neurofeedbackcs.com. I'm on LinkedIn under my name, J. Blair CANO. Our practice phone number is 719-639-2928.
Wow. Dr. Blair CANO, thank you so much for taking the time with us today here on this Veterans for Cannabis podcast. This is Joshua Littrell signing off. You all take care.